Okay, so let's talk about acetaminophen liver toxicity. So Tylenol or acetaminophen is one of the most common medications that we use for pain and for fevers. And we we tell people no more than 1 gram 4 times a day. So it's 4,000 milligrams. Um, and acetaminophen is in many, many mixed compounds, right? It's combined with decongestants and cold remedies, and so often people can take more than the 4,000 milligrams in 24 hours. So an acute overdose is when someone intentionally takes large amounts of Tylenol or acetaminophen, and this can cause acute hepatitis. So acetaminophen in larger quantities, and it doesn't take large amounts of acetaminophen to become toxic. So for example, for an adult, as you approach about 8,000 milligrams of acetaminophen, uh, you can become toxic and develop some hepatitis. So that's only 16 of the 500 milligram pills. So you can imagine someone who intentionally overdoses and takes a whole bottle of acetaminophen, how toxic it will be to the liver, and it'll cause an acute hepatitis with elevation of all the liver enzymes, AST, ALT, bilirubin. They'll be jaundiced. Typically, when someone overdoses on acetaminophen, they come in with the non-specific acute symptoms of nausea, vomiting, anorexia, lack of appetite. So they come in with those, and hopefully they tell you, I just took a lot of acetaminophen, because time matters with acetaminophen overdoses. The antidote, which is N-acetylcysteine, or Mucomyst is the brand name, is extremely effective as a reversal agent for acetaminophen toxicity to the liver. So it's highly protective. This drug of acetaminophen going on to cause hepatitis. In fact, I don't think there's been a case of liver failure if people have received N-acetylcysteine, Mucomyst, in the first 6 hours after an acetaminophen overdose. So very effective antidote. Okay, so let's talk about hepatic cirrhosis, it's really from years of chronic inflammation, whether it's from a virus, whether it's from alcohol, whether it's from some congenital liver storage disease like hemochromatosis or Wilson's disease, that's causing chronic inflammation. Cirrhosis is now the scarring and fibrosis stage, and it's really not reversible. The only thing you can do for cirrhosis is to go on to a liver transplantation list. So as it's stated here, chronic disease characterized by replacement of normal liver tissue with diffuse fibrosis. The hepatocytes are being replaced with fibrosis. The liver function is severely reduced, and the most common causes are listed there: alcoholic liver disease from chronic alcoholism, chronic hepatitis, viral B or C, non-alcoholic steatohepatitis, which I've mentioned a couple of times. Primary biliary cirrhosis, I put in there. It's a disease. It's an autoimmune disease that women get. Women unfortunately get a lot of autoimmune diseases more commonly than men. And this one is an attack on the small bile ducts within the liver itself. So it's not the big bile ducts, the little tiny ductules that that drain the bile and all collect together to then go into the hepatic ducts. The little tiny ones get fibrosed and damaged and scarred, and that leads to cirrhosis because there's no exit or drainage of the bile now, and the hepatocytes become destroyed, and over years of this chronic attack on the small bile ducts, women primarily can develop cirrhosis. So let's look at the next slide about early manifestations, which are non-specific. So these would be early manifestations of any kind of a hepatitis. So if you had an acute hepatitis, okay, well, you would have these: loss of appetite, nausea, vomiting, maybe some extra gas because you're not digesting fats, weight loss, fever, right upper quadrant pain. But if you had chronic hepatitis, you would also have these, plus other things that have become chronic, such as chronic jaundice, chronic dark urine. So just think of these symptoms as whether it's an early acute hepatitis or something that's become chronic, you'll persist with a lot of these symptoms. Okay, what about chronic liver disease that's gone on to cause cirrhosis? So remember, cirrhosis is where really it's become fibrotic and scarred, and the blood is having a hard time getting through the liver to get back into the systemic venous system. Okay, so when we're talking about cirrhosis, we're really meaning that the liver is just running low on hepatocytes and replacing them with fibrosis. So what's going to happen? Well, the portal vein is going to not be able to take the blood back to the liver. So you're going to get portal hypertension. Okay. So we're gonna talk about that, portal hypertension. So backup of blood that was coming from the gastrointestinal tract and the spleen is not able to return to the liver. Jaundice. So not processing bilirubin is going to lead to an elevation of bilirubin in the bloodstream. Peripheral edema. Well, your liver is no longer making proper levels of albumin, and you will start to become leaky into the interstitial fluid all over your body. Ascites is one site where in this slide you can see massive ascites where the portal vein is under higher pressure. So that's one reason that there's more fluid leaking into the peritoneal cavity. But also the lack of albumin in the bloodstream is not bringing the fluid by osmotic or oncotic pressure back into the portal system. So ascites. Confusion and decreased level of consciousness. Well, this is called hepatic encephalopathy, and this is where ammonia is building in the bloodstream. And the reason for that is amino acids, when the body wants to break down amino acids instead of making new proteins, it removes the nitrogen part of the amino acid. Every amino acid has a nitrogen group, and that, when it's removed, is ammonia. And ammonia typically gets converted to urea in the liver, and then urea, which is much less toxic, gets excreted in the urine. The urea cycle is not working well, ammonia builds up, and ammonia causes hepatic encephalopathy. Okay, and I think we'll talk about that a bit more. Hepatorenal syndrome is where the kidneys start to fail because the liver is failing. So now you're into multi-organ failure. So that's a really bad sign when two really important organs are now failing. And we think this syndrome is caused by reduced circulating blood volume to the kidneys because albumin is reduced in the bloodstream, which is causing leakage of serum and plasma into the interstitial fluid all over the body. That's why you have edema. So there's reduced perfusion to the kidneys, which can injure the kidneys. So that's hepatorenal syndrome. Bleeding. Patients with liver disease are at high risk of bleeding because they're no longer making clotting factors and their platelets are often very low. Plus, they have esophageal varices and gastric varices that are prone to rupturing. So you can imagine the perfect storm of a ruptured esophageal varices because of liver failure and not being able to clot the blood. They just bleed and bleed and bleed and bleed, and they cannot stop bleeding. So there's a lot of bleeding occurring. They can be vomiting up the blood, or they can be having melena stools. Caput medusa is just in that image there. The blood flow is doing, the circulation is doing everything it can to get the blood back to the inferior vena cava, and it's actually bypassing the liver finally. And those are dilated veins in the skin because the liver is so blocked that the blood flow has decided to go a completely different route to get back to the inferior vena cava and back to the heart. And you get these distended veins called caput medusa. Okay, so let's look at manifestations of cirrhosis. What do we expect to see with someone who has cirrhosis? Some or all of these. So they'll be jaundiced from the liver not processing the bilirubin. They could have esophageal varices because of the portal vein hypertension, and the blood is unable to flow through the liver. They'll have ascites for the same reason, portal hypertension. They'll have a swollen spleen since the spleen drains to the liver, so that's not going to be able to drain back to the liver. They can have an enlarged liver, hepatomegaly. Sometimes the liver can be shrunken in cirrhosis as well because it's so fibrosed and scarred down. Hemorrhoids, same reason, portal hypertension. Edema is due to the lack of albumin in the bloodstream, so there's no oncotic pressure. The change in mental responsiveness and memory is due to elevated ammonia levels, hepatic encephalopathy. The spider angiomas, that can be all over the place. Those are little arterial vessels that appear on the skin in cirrhosis. Anemia, thrombocytopenia. So why do you have anemia? Well, your liver's not working, you're likely, and you're not forming clotting factors, you're often bleeding slowly in the bowel, you have low platelets because of reduced stimulation of platelet production from thrombopoietin, which is made in the liver. You can have caput medusa, which are all those collateral veins on the abdominal wall trying to get blood back to the vena cava. Palmar erythema is red palms, and we won't get into the reason of why you have red palms in cirrhosis, but you do. Sexual characteristic changes. So often men can have enlarged breasts, gynecomastia. They can have small testicles. And lastly, with cirrhosis, you can have a peripheral neuropathy, where, especially in your feet, where numbness, tingling, due to the toxins that are building up in the bloodstream. Okay, so just another slide on cirrhosis to give you a good idea. So let's just do the pictures. So the top left is jaundice. Second down on the left is gynecomastia. Third down is a condition called clubbing of the fingers. Look how the ends of the fingers look like little clubs. And that often happens in chronic respiratory conditions or congenital heart disease. So little children that have congenital heart disease can get clubbing. Cystic fibrosis of the lungs is a classic one that can give you clubbing. There's another condition of the lungs called sarcoidosis, which can give you clubbing. Asthma does not usually give you clubbing, okay? But cirrhosis can also give you this very odd collection of soft tissue and edema at the end of your digits called clubbing. The bottom left is just showing the edema that you get with cirrhosis due to low albumin. The top right, I think they're trying to show parotitis. You can get swelling of your parotid gland in cirrhosis. We won't get into the mechanism, but you can have swollen parotid glands. You almost look like mumps, and I think that's what they're trying to show you there. Second down on the right is spider angiomas, and that's exactly what they look like. Okay, and that's from, so we used to call those liver spots. Third one down is pulmonary erythema. So we can look at the palm to see if people have pulmonary erythema in cirrhosis. And lastly, there's ascites on the bottom right. Now, if you look at the image on the right now, the man standing there, so there's effects of portal hypertension, and I think they'll start to make sense. So those are all the ones on the left. And the effects of the liver failure. So coma, that's hepatic encephalopathy. You give off a very particular breath. It has an awful name, fetor hepaticus. It's a bad breath. Spider nevi, enlarged breasts, gynecomastia. Yellow skin, jaundice. Ascites, that accumulation of fluid in the peritoneal cavity. Loss of sexual hair because the estrogen is having more of an effect than testosterone. So men will have loss of sexual hair. Testicular atrophy, again because estrogen is having more of an influence than testosterone. The liver flap is when you ask someone to put their hands in front of them and to extend their wrists, and they often flap back and forth. Maybe we have an image of it later, or you should check it online. A liver flap of cirrhosis. Bleeding tendencies, well, that's from lack of coagulation factors. Anemia, we've spoken about. And edema, well, edema can be all the way up the legs with liver failure. And it can be onto the abdomen too, because there's the albumin in the bloodstream is dropping, so you're leaking your fluid all over your body. So here's a nice picture of the hepatic portal vein. You can see that starting from the esophagus all the way down, the portal vein is taking blood from the gastrointestinal tract and draining it back to the liver. So you can imagine if you have cirrhosis that the hepatic portal vein is going to be under high pressure and leak fluid into the peritoneal cavity called ascites. It's going to enlarge those veins in the stomach and the esophagus called esophageal varices. It will, and that's why in cirrhosis, People often have nausea, vomiting, lack of appetite. All the veins are enlarged in their esophagus, their stomach, their intestine. So they're having difficulty digesting. Um, they can't get the nutrients very well to the liver. They just feel awful. And part of it is because the portal hypertension is stopping flow of blood from leaving the GI tract. Now, I mentioned the hepatic artery before. So remember, the hepatic artery is really just to feed the the liver with blood. Just like the coronary arteries are to feed the heart with blood. So that's the only real function of the hepatic artery. And you can see that it will join into the circulation there and finally go out the hepatic vein to flow back to the heart. So it's not a big issue here, the hepatic artery. We're looking more at portal hypertension caused by cirrhosis. Okay, so esophageal varices. So if you can imagine this backup of fluid in the portal system because the vein or the liver is just not allowing blood to flow through it any longer due to fibrosis, then you can understand that there's going to be almost like varicose veins all over the place in the esophagus, in the stomach. And the biggest risk for these is if they bleed, if they tear. So if you're eating food and one of them tears, or the acid in your stomach with a gastric varice and one of them tears, you will bleed profusely. You will vomit large amounts of blood and you will have black stools. And this can lead to hypotension. And you will quickly go into shock. So hypotension, cold, clammy, pale skin. So the sympathetic system is turning down blood flow to the skin. Tachycardia, decreased urine output, restlessness because your sympathetic system is being activated, and weak peripheral pulses. These are all signs of hypovolemia of any cause. Okay, so these are very serious when they bleed. There's a high mortality from bleeding esophageal varices.
Okay, so let's do another question. What is the most common complication of esophageal varices? So remember, esophageal varices are dilated veins in the esophagus. And they can actually also occur in the stomach, and we call them gastric varices. So why do people develop esophageal varices? Well, if you remember that the portal system, which is the blood that's leaving the gastrointestinal tract, has to go to the liver, right? The portal vein, or we call it the portal system. So from the esophagus, the stomach, the small intestine, the large intestine, it's going to the liver to be processed, right? The blood is. So if you have a problem with the liver where there's a lot of cirrhosis, meaning there's a lot of fibrosis and a lot of the ducts are blocked and scarred, and the blood supply is being blocked from getting through the liver on its way back to the inferior vena cava, well, you're going to get backup of fluid at the gastrointestinal system. And that's what causes these dilated veins that we call esophageal varices. Okay? So what's the dreaded complication and a potentially common complication is hemorrhage, right? So you're eating food or the patient's eating food, the esophageal varices can potentially tear. And when they tear, there's nothing to stop them from continually bleeding. And these patients can bleed tremendous amounts of blood. So either they'll come in vomiting large amounts of bright red blood, or they'll come in with massive amounts of melena, okay, from the rectum. All right, so what's the most common complication? Hemorrhage, okay? And it's definitely a feared complication of this condition that is secondary to cirrhosis of the liver.
So here's another complication of cirrhosis with an image. This is a man with ascites, and this is purely from inability of the portal vein to flow back to the liver, and also partly contributing to it is the inability to reabsorb fluid back into the portal vein because of low albumin. Okay, so due to portal hypertension and hypoalbuminemia. So how do we follow people with something like ascites? Well, daily weights and measuring abdominal girth, which to see is this enlarging. And this is very hard on the respiratory system. When you lie flat with all this fluid in your abdomen, it's very difficult to breathe because all this fluid pushes on the lower side of the diaphragms and makes the lungs more compressed. So breathing becomes difficult lying down. And what we sometimes have to do is people get so uncomfortable is that we'll drain this. We'll put a needle in the lower abdomen and remove many liters of fluid to reduce the volume of the ascites and give comfort and improve respiratory status for the patient. Okay, so let's go into a bit more detail of a hepatic encephalopathy. It's not like everybody who's walking around with cirrhosis has hepatic encephalopathy, but you can get some kind of illness, or so you get diarrhea and get dehydrated, or anything that causes the body to have an added stress, and you can develop hepatic encephalopathy very easily in the setting of cirrhosis. So, or just as your liver decompensates further, you can develop this. And it's caused by elevation of ammonia in the blood, because the urea cycle that takes ammonia and converts it into urea to be urinated out is no longer working well in the liver. So the ammonia levels increase. Ammonia is NH3, in case you're wondering. So the symptoms of hepatic encephalopathy are increasing confusion, fatigue, decreasing level of consciousness, this hand flapping or the liver flap called asterixis. And just look it up once so you know what it looks like. I can't describe it really over a voiceover, but once you see it once on YouTube, you won't forget it. And remember, this is all in the setting of cirrhosis. And so where does all this ammonia come from? Well, the liver is constantly breaking down proteins and amino acids, and it metabolizes them. And when it metabolizes them, it breaks off a nitrogen group. And that nitrogen group is NH3. It's called ammonia. And then the rest of the protein or the amino acid molecule gets used as energy. But it's really the ammonia that's toxic to the body, okay? And in a normal functioning person, it's just turned into urea and out into the kidneys it goes, okay? So the treatments will really consist of getting rid of the ammonia and treating the elevated ammonia in the bloodstream so that we can reduce all these symptoms that they have. Okay, so this slide isn't really meant for you to memorize all the grades of hepatic encephalopathy. It's just to show you the progression of hepatic encephalopathy, all the way from minimal symptoms. Maybe on testing you have some forgetfulness, all the way to grade 4, which is coma, and you're just unresponsive. So again, from ammonia levels. So it's really the inability of the liver to process its ammonia. And the neurological changes, as mentioned before, is descending level of consciousness, confusion, slurred speech. Obtunded is before stupor, and then stupor is before coma. Okay, so it's a whole spectrum as they have reduction in level of consciousness. The treatment for this is oral lactulose, and you may have heard of lactulose already as a laxative, but it absorbs ammonia. So not only does it keep ammonia from being absorbed from the GI tract to the liver, it can pull ammonia out of the bloodstream and reduce ammonia levels. And we can give it orally, unless they're in a coma, or we can give it as a rectal enema. So we can infuse large amounts of lactulose into the colon for absorption of ammonia. So here's just another syndrome that's nice just to know the term, hepatorenal syndrome. So this is in the setting of someone with liver failure, i.e. cirrhosis. And we noticed years ago that people with cirrhosis and liver failure, the kidneys would start to fail as well. And for years we had no idea why. We actually called it hepatorenal syndrome, but we didn't really know the reasons for it. So obviously as the kidneys start to fail, more toxins will build up, because now not only the liver's not working, but the kidneys are failing. So toxins are going to build up very quickly. Okay, so this condition is almost always caused by liver cirrhosis first. Okay, and in the diagram here, it gives an explanation of, so portal hypertension causes vasodilation. So all the veins are dilated, and that's why you have esophageal varices and gastric varices, but all through the gastrointestinal tract. And you're leaking fluid into your peritoneal cavity called ascites. Well, that actually reduces circulatory volume in your normal circulation, your arteries and your veins going to all the different organs. And this activates the renin-angiotensin system. So renin says, or the kidneys say, well, you must be hypotensive. You need more fluid. I'm going to activate this system to finally release aldosterone and reabsorb even more water and more salt. And what does that do? Well, it makes the whole situation worse, because you're already leaky from low albumin, and now you're reabsorbing salt, which is going to aggravate more edema all over the body. When you reabsorb salt, you reabsorb the water in the kidneys with it, so more ascites. And the kidneys also respond with vasoconstriction now. So they've activated this system, and now there's renal vasoconstriction because they've increased the volume. So the kidneys now say, okay, I'm going to vasoconstrict. And that leads to renal failure. We think this is the mechanism. So hepatorenal syndrome, liver leading to kidney failure. Bad combination.